Talk about health now. January is Cervical Cancer Awareness Month, and while it's a disease women face, we can all be impacted by it.
That's right. An alarming new study finds more older women are dying from this disease despite it being preventable. I talked with a doctor about screenings and the woman behind the research that may surprise you.
There's a point in everybody's life where you can think about how you can prevent this.
A new study by the UC Davis Comprehensive Cancer Center finds an increase in women 65 and older dying of cervical cancer, despite CDC guidelines recommending women stop screening at that age.
It's one of the cancers that we know that we have a tool that we can help prevent this from ever happening.
The Cancer Center says cervical cancer is most frequently diagnosed in women between the ages of 35 and 44. The average age of diagnosis is 50. It rarely develops in women younger than 20.
We saw that although women over 65 are not recommended to be screened for cervical cancer, about 1 in 5 women who are diagnosed with cervical cancer are actually over the age of 65. Unfortunately, the majority of them are diagnosed late stage, about 71% of them.
But many older women don't realize the risk of getting this disease is still present as they age.
Well, I'm hoping that the study has raised some awareness that cervical cancer is still a huge problem among women over 65, and that many women under 65 have not actually been screened.
Here's what to look out for.
Most patients who are diagnosed with this cancer have ambiguous symptoms, but I think knowing the signs and symptoms to look for any patient is the biggest thing.
And here are some risk factors.
Prevention in the sense of before even getting to adulthood is considering the HPV vaccine for our younger women and our children at the age of 9 and up.
The American Cancer Society estimates there will be nearly 14,000 new cases of invasive cervical cancer diagnosed this year. The society also estimates this year more than 4,000 women in the U.S. will die from the disease. Dr. Wynn encourages regular pap smears and HPV vaccines for young women. Call your doctor or the UC Davis Comprehensive Cancer Center to make an appointment. We have all that information on our website, abc10.com.